Welcome to the KenkoVibe podcast. I'm Ethan Reed.
And Grace Morgan.
And today we're going to be doing a deep dive on a topic that might be a little bit personal for some folks out there.
Yeah.
Erectile dysfunction.
That's right.
But we're going to try to cover it.
It's important.
Yeah, it's really important.
And really common.
And a lot more common than a lot of people think.
Absolutely.
So we're going to equip you with all the knowledge you need to understand what causes it, how it's diagnosed,
Yeah.
and what some of the latest treatments are out there.
That's right. Knowledge is power, guys.
So let's jump right into it. When we say erectile dysfunction, what are we actually talking about?
So essentially, we're talking about the consistent inability to get or maintain an erection that is firm enough for sexual activity.
Okay, so not just a one-off situation.
Yeah, I think that emphasis on consistent is important. We all have off days every now and then.
Right.
But if this is a recurring problem, that's when it's time to start paying attention.
Okay, so you mentioned that it's more common than people realize.
That's very
How common are we talking?
Like way more common than you think.
Yeah.
Half of all men over 40 experience ED to some degree.
Wow.
So if you're listening to this and you think, oh my gosh, this is me, you are absolutely not alone.
Now, a lot of people think that ED is a psychological issue.
Right.
Is that the case?
It's a really common misconception. While psychological factors can contribute, they're certainly not always the root cause.
Okay. So what are some of these physical things that can be going on?
Yeah. So you've got your usual suspects that kind of tend to go hand in hand.
Okay.
Things like diabetes, hardening of the arteries, high blood pressure, high cholesterol.
These all sound like pretty serious conditions on their own.
They are.
How do they actually connect to ED?
So it really all boils down to healthy blood flow.
Okay.
You know, all of those conditions that I just mentioned can negatively impact blood vessels, making it harder for the blood to circulate properly.
Yeah.
And guess what needs good blood flow?
An erection.
Exactly.
Okay.
So managing these conditions is not just important for your overall health, but for your sexual health too.
So it's not just all in your head. It could be a sign of something else that's going on.
Yeah, exactly.
Are there other physical causes besides those?
Absolutely. So hormonal imbalances, especially low testosterone, can be a big factor.
Okay.
Testosterone is really important for male sexual function. So when those levels dip, it can have a direct impact.
Okay. So hormones are on the list. Anything else?
Neurological disorders like Parkinson's disease, stroke, multiple sclerosis can affect the nerves involved in getting an erection. And believe it or not, some medications can have ED as a side effect.
Wow. It's a pretty wide range of things.
Yeah.
So how do doctors even begin to diagnose ED when there's so many potential causes?
Well, it all starts with a really detailed medical history. You know, they're going to play detective.
Good
Want to
one.
know, when did these problems begin? Have you had any injuries? Any recent physical or emotional changes? What medications are you taking?
So being really open and honest with your doctor is probably really crucial here.
It's super important. And they'll also dig into your lifestyle. Things like smoking, alcohol consumption, weight, even your work habits can come up.
Work habits.
Yeah.
How do work habits play into this?
Well, believe it or not, sitting for long periods of time can restrict blood flow to the pelvic area.
Oh, really?
So if you're at a desk all day, make sure to get up and move around regularly. Those little breaks can make a big difference.
Good to know.
Yeah.
So after they've done all the detective work of the medical history, what's next in the process?
So they'll do a physical exam, which might include checking testosterone levels. And depending on what they find, they might order some blood and urine tests to rule out other underlying conditions.
What kind of blood and urine tests are we talking about?
So they might check your blood sugar to rule out diabetes, your cholesterol levels, hormone levels, red blood cell count, all sorts of things.
Wow.
Basically, they're trying to get a really clear picture of your overall health and how it might be contributing to ED.
So it's really a holistic approach.
Yeah.
Not just focusing on one isolated issue.
And sometimes they'll recommend a test called a penile Doppler ultrasound. Okay.
I know that sounds kind of intimidating.
A little bit, yeah. What is that? It's a non-invasive procedure that uses sound waves to create images of blood flow in the penis.
So they're basically looking to see if everything's flowing as it should be.
Precisely. And it can help them assess the severity of the ED and figure out the best treatment options.
Okay.
And if no physical cause is found, they might recommend a psychological evaluation.
Right. Because we talked about how psychological factors can play a role.
Exactly.
So if they rule out everything physical, it makes sense to look into that as well.
Definitely. Now let's bust a big myth
Okay.
that ED is only a problem for older men.
Yeah, I feel like that's a pretty common assumption.
It is, but the truth is that ED can affect men of all ages, even those in their teens and 20s.
Really? I didn't realize they could start that young.
Yeah.
What about another common concern? Medications for ED.
Yeah,
Are they safe?
that's a great question. There's a lot of anxiety around that, especially the myth that they can cause heart attacks.
Yeah, that's a pretty scary thought.
It's important to remember that while there are some contraindications for certain patients, like those with heart conditions, these medications are generally safe for most men when taken as directed by a doctor.
So once again, having that open and honest conversation with your doctor is crucial.
Absolutely. They can assess your individual health history and determine if those medications are right for you.
All right. So we've talked a lot about causes and diagnoses, but let's get into the treatments.
Let's do it, and let's get into those treatments.
So, we've talked about the physical causes of ED,
Right.
but I imagine there's a pretty big emotional component to this as well.
There is. Getting diagnosed with any health condition can be stressful, but ED can be particularly tough.
Yeah,
It can make guys feel inadequate or embarrassed.
yeah, I could see
It
this.
can make them withdraw from their partners.
Right.
So it can really impact relationships.
And I imagine that creates a vicious cycle.
It does. The more anxious you are about ED,
Yeah.
the more likely it is to impact your performance.
So what can guys do about that?
Communication is key.
Okay.
Talking to your partner about your concerns can really help reduce anxiety,
Right.
strengthen your relationship.
So it's really about facing the challenge as a team.
Exactly.
Now, before we went to the break, we were talking about the penile Doppler ultrasound.
Yes.
Can you explain a little bit more about why that test is so important?
Sure. So it really helps doctors understand the dynamics of blood flow in the penis,
Okay.
which is crucial for identifying the root cause of the ED.
Uh-huh.
Like, for example, it can help determine if there's a blockage in an artery
Okay.
or if the veins aren't closing properly to maintain the erection.
So it's not just confirming that there's a blood flow issue. It's about figuring out the specifics of what's going on.
Precisely. And that level of detail is essential for determining the most effective treatment approach.
Now, speaking of treatments, I think it's time to address the elephant in the room.
Yeah.
Needles.
Oh, yeah. Nobody likes needles.
Are injections a common treatment for ED?
They can be, but the good news is that they're not the only option.
Okay, good.
There are a variety of approaches ranging from lifestyle changes and oral medications to topical creams and even vacuum devices.
So it sounds like there's not a one-size-fits-all solution.
Absolutely.
It's about finding what works best for each individual.
Exactly. And that's why having that conversation with your doctor is so important.
Right.
They can assess your specific situation
Uh-huh.
and recommend the most appropriate treatment plan.
So let's talk about those treatments.
Yeah.
What are some lifestyle changes that can make a difference?
So if you smoke, quitting is a huge one.
Okay.
Smoking damages blood vessels and restricts blood flow throughout the body, including to the penis.
So that's a win-win situation.
It is. It's good for your overall health and your sexual health.
Absolutely. What about exercise?
Exercise is great, especially aerobic activities like brisk walking or swimming.
Uh-huh.
It can really improve cardiovascular health
Okay.
and boost blood flow.
So hitting the gym more often is a good idea.
It's always a good idea.
Yeah. And what about diet? Does that play a role?
Absolutely. A heart-healthy diet that's rich in fruits, vegetables, whole grains, and lean protein can really help
Okay.
improve blood flow and overall health.
So ditch the processed foods and load up on the good stuff.
Exactly. And don't forget about stress management.
Stress management. Yeah, that's huge.
Stress can really wreak havoc on your hormones
Uh-huh.
and make ED worse.
So what are some effective ways to manage stress?
Things like yoga, meditation, spending time in nature, or pursuing hobbies you enjoy can help.
Yeah.
It's all about finding healthy outlets for that stress.
Rather than letting it build up.
Exactly. And if you're struggling to manage stress on your own, consider talking to a therapist or counselor. They can teach you some coping mechanisms
Right.
and help you address any underlying emotional issues.
So once again, it's about a holistic approach.
Absolutely.
Addressing both the physical and psychological aspects of this.
Now, in addition to lifestyle changes, there are a number of medical treatments available. Oral medications are often the first line of treatment, and they work by increasing blood flow to the penis.
Those are probably the ones that most people are familiar with.
Right. But there are other options too, like topical creams,
Okay.
which work similarly to the oral medications but are applied directly to the penis.
Interesting.
And for men who don't respond to medication, there are options like vacuum pumps and penile implants.
So it sounds like even if one treatment doesn't work, there are still other avenues to explore.
Exactly. And that's why it's so important not to give up hope.
Right.
There are effective solutions out there.
Yeah.
And with the right guidance, you can find the one that's right for you.
Well, this has been incredibly insightful. I really appreciate you taking the time to talk about this today.
My pleasure.
And to our listeners, thanks for sticking with us for this deep dive into erectile dysfunction. It's a complex topic, but we hope you found this conversation informative and helpful.
We hope so too. And with the right guidance, you can find the one that's right for you.
Absolutely. And, it's been a really fascinating conversation. And
It has.
it's amazing to me just how interconnected our physical and emotional health really are,
Right.
and how ED can be a symptom of something much bigger going on.
Yeah, absolutely. It's not just about sex, it's about overall well-being.
Exactly. And I think that's an important message to really hit home. We often try to compartmentalize our health,
We do.
but it's all connected.
It really is.
So I think as we wrap up this deep dive, I want to go back to something that we talked about earlier,
Okay.
and that's the importance of communication.
Yes, communication with your doctor, with your partner, even communication with yourself.
Exactly. It's about being honest about what you're going through,
Yeah.
taking that first step towards getting the help that you need.
And breaking down those walls of shame and stigma
It
that
is,
so often surround ED.
It's not an easy conversation to have,
It's not.
but I think the more we talk about it, the more we normalize it,
Absolutely.
and the easier it becomes for men to seek help
For sure.
without feeling judged or embarrassed.
Exactly.
So if you're out there and you're dealing with this, please know that you are not alone.
You're not.
Reach out to your doctor, talk to your partner,
Yeah.
and seek the support that you need.
There are effective treatments available.
Absolutely.
And with the right guidance, you can reclaim your confidence
Yeah.
and enjoy a fulfilling sex life.
This has been a really eye-opening conversation.
It has.
I really appreciate you being here today.
It's been my pleasure.
And to all of our listeners, thank you so much for joining us for another deep dive here on the KenkoVibe podcast.
Yes,
We hope you found this information helpful and empowering.
we do.
If you enjoyed this episode, be sure to subscribe to the KenkoVibe podcast for more deep dives into fascinating health topics.
Yes, and don't forget to like, comment, and share this episode to help spread awareness and break down the stigma.
Absolutely. Until next time, take care of yourselves and each other.
This is Grace Morgan signing off.
And I'm Ethan Reed. Stay healthy, everyone.